Air conditioning has provided relief to many Americans during recent heat waves, but in Upper Manhattan, it has also contributed to a serious health crisis. Inside the cooling towers of several apartment buildings, bacteria have thrived due to poor maintenance. These bacteria were then spread into the Harlem skyline by the air conditioning systems, leading to an outbreak of Legionnaires' disease. Since late July, at least 67 people across 5 zip codes in Harlem have contracted the disease. 24 required hospitalization, and 3 have died. This is the largest outbreak in New York City in a decade, and officials expect more cases. The city has already tested all cooling towers in the affected areas and treated those found contaminated, according to Mayor Eric Adams. Legionnaires' disease was once rare, first identified in 1976 after an outbreak at an American Legion convention in Philadelphia. Since 2000, cases have increased 9-fold nationwide, a trend linked to rising temperatures and higher humidity caused by climate change. Hotter weather strains infrastructure, especially cooling systems that are not designed for such extreme conditions. The bacteria responsible, Legionella, thrive in water temperatures between 77 and 113 degrees Fahrenheit, making poorly maintained cooling towers ideal breeding grounds. The Northeast's recent stretch of extreme heat and flooding likely contributed to the outbreak. Legionnaires' disease causes severe pneumonia-like symptoms and spreads through airborne bacteria in water systems, not from person to person. Although treatable with antibiotics if caught early, symptoms often resemble the flu, leading to delays in diagnosis. Historically, outbreaks tend to impact lower-income and non-white communities. The current cluster affects Central Harlem, a predominantly black neighborhood. Previous outbreaks in New York have centered around the Bronx, particularly in areas like Highbridge. Experts note that these marginalized communities are more vulnerable due to higher rates of chronic health conditions such as asthma and COPD. City health officials advise residents in the affected zip codes to watch for symptoms and seek medical care promptly. Older adults, smokers, and those with lung diseases are at higher risk. Despite the outbreak, residents are encouraged to continue using air conditioning and water-based appliances, as the health risks from heat outweigh those from Legionnaires' disease. Public health experts stress the importance of maintaining urban infrastructure to prevent future outbreaks. Cities nationwide should prioritize proper upkeep of cooling towers and similar systems to protect vulnerable populations from this growing threat.